So now what we're going to do, we're going to transition to the first talk of the day. I'm presenting today on a pretty important topic. I feel like for this event specifically, it's trying to talk about the integration of sports sciences into teams, high-performing teams, with a specific focus on baseball. And that's where a lot of this world is moving to, from a standpoint of, I don't know if people realize, but in most of these teams, there's at least 60 people involved that aren't skill position coaches or executive staff, meaning there's chiropractors, medical doctors, physical therapists, athletic trainers, massage therapists, chiropractors. We've got a series of mental skill specialists, data analytics, performance analytics, other specialists, sleep scientists that all work with these teams now, not only in baseball, across the professional landscape, and now also in the college landscape. So for all of us, irrespective of what our skill set is and what our specialty is, we need to be reasonably well versed in that entire spectrum of what's going on. Not necessarily that we're going to be doing the treating in those areas, but we do need to understand what our colleagues are doing. We need to be pretty well up to speed on what's available, what's out there, what scenarios we can utilize. So that's really the purpose behind this sort of introductory presentation. It's really trying to try a lot of these groupings together, and also to make you think a little bit. For the students in here, what you guys are studying and what you're going to need to do in 5 years may be very different. Your knowledge, your skill set, the types of things that you're going to be asked to do in the workforce is changing rapidly. And you're going to have to make sure that you're keeping up with a lot of things that are going on in addition to your skill set. Most of you work with your hands. Most of you are treating athletes, and that's what you love to do. However, as all the professionals in here that have been working for a number of years will tell you, there's a lot more to the job than just treating athletes. So you need to be aware of everything else that's going on. A lot of teams now are structuring it where you've got a high-performance director type role. And the interesting part about this position is there is no job description for this, meaning that every team has a different type of person in that role. So there is every specialist across the spectrum who sits in these positions now. It could be an executive type person with a business or organizational background. It could be a sports medicine professional across the various disciplines. It could be a strength and conditioning professional. It could be a data scientist that sits in this role. So the challenge for that role that is somewhat undefined is that it has to manage and oversee all the different specialists. So everyone that puts their hands on an athlete, plus everyone that is analyzing those athletes, meaning the people that are looking at the statistics, the people that are analyzing the daily data. This all feeds in now, and there's a big movement, as you're all aware, going to data, understanding data, measuring everything with a goal. And the challenge right now is the goals are relatively undefined. Everyone says improve performance, reduce injuries. That's too broad. We need to specify what is that. And in your situations, you need to understand what does that mean to you in your roles. What's improving performance look like? How do you define success? What's it measured? And what's a positive outcome? Reduction of injury, is that just the DL? Is it just the numbers of days missed? Is that a good enough metric to say, hey, that's good enough for us to use as our main metric? For most scenarios and most teams, that's the only metric they use. If your athlete's on the field, that's a positive. The challenge is if they're at 70% and on the field and their production goes down, is that a performance issue or is that an injury issue? That's where all of you come in and make that determination. If my athlete's only able to perform at 70% due to some limitation, we need to do a better job of determining is that defined as injury or lack of performance and what's causing what. So that's really important to think about as you get in these scenarios and talk through these special situations. As we say, the goal's to blend these two. The challenge is, for most of the folks in this room, everything's coming at it from the injury standpoint, predominantly. People come to see you because they have pain, because they have injury. Then the question is, how do we shift the discussion talking about performance enhancement is injury reduction, and injury reduction is performance enhancement. If we look at it from both perspectives, we are going to do a much better job with our treatment and with our care of our athletes. And that's really, really important to utilize your networks, utilize your colleagues to find the solutions. Because the athletes most of you are dealing with are at a pretty good level. They may not be professional athletes always that you're dealing with. You're dealing with collegiate athletes, high school athletes, youth athletes, senior athletes, but they're all playing relatively competitively, and they want to make sure they can do this at the highest level possible. So, do we know the 10-year trends right now? So hitters in red, pitchers in blue. This is just generic to show where we're trending up slightly. It's not as extreme, I think, as a lot of the media reports make out. You see this across sports. Injury trends are up in this sport, in that sport, in youth sport. They are to a certain extent. The question we have to always ask ourselves is, are we doing something different in how we monitor injuries? There's more awareness now. People are a little bit more conservative. People are a little bit more cautious in how things are evaluated. So things that may have been played through in the past and now take days off, which is probably a good thing, actually, but it may skew some of these stats as well, saying that, do we really have more injuries? To a certain extent, we do. There's no doubt about that. There's more things going on in an athlete's life. The question for all of us is, how do we help reduce this number through the skill sets that you all have? And you're going to hear some great, presentations that are clinically based to help you with your skill set the next couple of days. This presentation is really just to make you think, to hopefully get you thinking about ways that you can integrate better, you can communicate better across the different folks that you work with, and try to use some of the various skill sets that are available to you. So if we have a look at Tommy John's, this is significant spike. Again, anything before the 90s we have to be a little cautious about, just because of how things were monitored. As things get better and better, and the descriptions and the definitions, but we do see an upward trend, no doubt. There's definitely an upward trend, and this, we're going to hear some good things about this in the talk after lunch for sure, and really talking into the specifics of it and getting into more detail. But it's really, really important that if we're working with pictures, this is one of the major issues that all of us deal with. One, not necessarily all the way to surgery, but elbow pain, shoulder-related pain that could result in elbow problems. So those are those areas where we need to have strategies very well defined. And there's some phenomenal professionals in this room that have been dealing with this for 20 or 30 years. And for the students in here, pick their brains. You got some of the smartest minds anywhere on the planet in here today, and ask them the questions about how they deal with the most common issues. Remember, everyone knows about a needs analysis for the sport of baseball. Do you know where the major issues are, and do you know what the major causes are? So many of you don't necessarily know the technical aspects of baseball, hitting biomechanics or pitching biomechanics in great detail, but you probably should. You should probably have an awareness of what causes some of the things that you see in the clinics, on the tables, in the training rooms that you work in. So it's really, really important to have a very clear picture of where your athletes are at and what's causing some of it, so that you do a better job on the treatment side. So position players. So if we have a look here, we're looking at, we've seen the soft tissue injuries in the blue and everything else in the red. So more than 50% are soft tissue related. So as a broad scope generalization, there's a lot of stuff that should be preventable. And even some of the other is probably preventable as well. But in general, at least 50 to 60% of the injuries that we typically see, we have a shot at preventing most of those, if we understand the causes better. So the challenge is, we're still learning as an entire profession, across professions, what causes injury. Anyone that can tell you they can prevent an injury is probably overspeaking a little bit or overstepping in their guarantees. It's very, very difficult, one, to predict what causes an injury specifically down to one or two things. We know that. All the predictive models that have been done on injury prediction are poor at best. So from a standpoint of understanding the direct one-to-one correlation, That doesn't mean that we shouldn't be assessing, screening, doing all the things that we do. That definitely gives us a window, and it gives us a very, very important piece of the puzzle. But there's so many other factors that contribute. Volume, we know, is a huge factor that we need to make sure all of us understand. You can do the best job of treating. If the athlete goes out for 4 hours the next day and does a repetitive movement over and over and over again, doesn't matter what you do, they're still going to have issues. So we need to understand that this injury prevention concept is a goal, but the prediction aspect of what we do needs to be better understood. And there's a lot of people working on that. You know, a lot of computers are actually working on that. So just plug in lots of data in, and then trying to determine trends, trying to determine correlations, and trying to determine scenarios that can help us all do a better job of the areas we're focused on. So the challenge here is there is really no secret formula, because every athlete's unique and every sport is unique. And most of you work across multiple sports as well as baseball. The challenge becomes a treatment technique, a strategy that works for one athlete may not work for the other. And we know that. I think most people understand the concept that there are genetic factors that contribute to injury. There are multiple factors with how people respond to certain treatments. That's why we have to be very careful when we're reading research. I'm a researcher by heart. Most of the stuff I do is very evidence-based. The challenge with research is it's all group means, nearly always, meaning that we pull data on 20, 50, 100, 1,000 people, and then we look at the average and we say, hey, the average got better or didn't with this treatment, which is really, really important. We need to understand, is there a statistically significant improvement in this treatment technique? However, that doesn't mean that it works for everyone. We have outliers. Outliers is what most of us deal with on a daily basis. Anyone here that works at an elite level, at the junior level, at the collegiate, at the professional level, every single one of those people that walk into your clinic, walk through your doors, is an outlier. That's who they are. That's why they're at the level that they're playing at. So we have to be real careful with looking at generic group data that may not be on the population group that you're working with, and taking that information and running with it as if it's gospel for that athlete that walked in your clinic. So we definitely need to use that information to understand if certain techniques are a waste of time. Because if you've got a less than 20%, less than 30% likelihood of something working, you're probably going to use a different technique. You're going to use something that gives you a much better chance of success. But we have to be aware of what works and what doesn't, and what the evidence is directing us to go to. However, we also then need to account for the individual differences of our athletes and then integrate that into the environments that we work in. Really, really important concept, because we see now, unfortunately, really in-depth research being presented in one line or in 2 lines or in 3 sentences, and it's a headline. And the headlines are interesting. Hey, do this treatment and reduce injuries by 7 times. Okay, that's a great headline. The problem is you don't understand that was only done on 6 people, 8 people in this environment with a certain sport at a certain level. It may not be able to be taken outside of that small group that they were assessing. So you have to be really, really careful when you hear some of this information being presented, because a lot of the time there's really good research that is still very limited, even if it's done perfectly well. And then unfortunately there's a lot of research that is done very poorly and still is able to get published in certain areas. So you have to understand the quality of what you're reading and what you're using. Because most of you are clinicians, most of you aren't researchers, I know, in this room. You work with athletes every single day, and you want to know what's the quickest, best way to get my athlete better. What's the fastest, most effective way to make them perform at their highest level. So you're trying to find those sources, you're trying to find those solutions, but you have to be a little critical in how you evaluate everything. So when we're talking here, this high-performance team concept, which is really, really important, this is straight from a business textbook. Got nothing to do with sports. It's got to do with business culture and the environment. And we're looking at common buzzwords, common purpose, clear roles, accepted leadership, effective process, solid relationships. That's a team of any environment. And most of you are going to be working in some form of team environment when you're working with athletes. It's very, very rare if you're working with an athlete that you're the only person that they get their advice from or get their treatment or training from. You may have a big percentage of it, but there's still going to be other people. It could be parents, it could be coaches, it could be other specialists that they go see. So if you just narrow in on your focus and really keep it to your area only from a standpoint of understanding that athlete, we're going to miss things. It's just part of it. It doesn't mean you have to spend hours speaking with everyone and understanding everyone else's what they're doing, but we do have to be aware. It's similar in the world of, when the left side doesn't speak to what the right side's doing. If we don't have that understanding, things are going to fall through the cracks and the athlete misses out. And the whole purpose of all this is how do we make our athletes better and how do we get the best success in our environments. So if we have a look here, these are sort of generic high-performance team concepts. So this is shifting now more so how do teams function better in these professional environments. From our perspective, adaptability, you have to be adaptable. I mean, any of the folks here that have worked in the professional environments for any period of time will realize that every week and every month and every day is different. Different leadership styles from the executive officers changes the dynamic. Then the skills that you implement are going to be the skills that you have, but how you implement them and how you communicate them vary greatly. If you're speaking to a skills coach, you're going to communicate that very differently to how you communicate it to another, medical type professional. So we have to be really clear on how adaptable we are. We're going to have some philosophical red lines that you probably can't break and you don't want to break. You want to make sure you know where your sort of boundaries are about how you do things, what you believe in, what the research tells you to do. But then there's a lot of gray area in between. So in the gray areas where most people live is you've got to make judgment calls every single day. What treatment technique am I going to use? How many days rest am I going to give this athlete? When am I going to bring them back? How quickly can we bring them back? We have timelines, we have procedures, we have return to play protocols. We have all that, but that's a guide. That's all it is. Every athlete responds to those timelines differently, and we have to be smart about how we implement them. If you just, let's say, it's an ACL recovery, and you're involved in the rehab process. It's a 9-month process for most, maybe 12-month process for most athletes. But every day is not going to be the same. Athlete A versus athlete B, their timelines are different, their quickness to recover is different, and we have to adapt based on that. The only way we can do that effectively if we monitor. Without the data, you're guessing, so you have to do a really good job of monitoring, one, what they're doing every day as best you can, but two is what the improvement is and how you define that improvement. So if we start shifting now to the sports environment, really bring it into sort of our world more specifically. This was a really good summary of some of the research out there on teams. And you have a look at these things. I don't think anything here is things that you wouldn't be aware of. The team learns from their mistakes. They're innovative. People are coachable. People motivate and inspire others. Nothing here that I don't think is not common sense. We're all aware of the concepts, but if you truly did an evaluation of the teams you currently work in, if you're a student, you're working in teams, you have your professors, you have your students that you work in groups on projects with, everyone works in a team of some sort. There's no one in the athletic world that works 100% by themselves, because you at least work with an athlete. So you've got a team. It could be a team of two, but you have a team. So you have to make sure that you understand the principles and understand how all this is put together. And it's really, really challenging because, as they say in business is easy, people are difficult. It's the same thing in sports. Training and treating athletes is pretty easy. Dealing with all the other stuff is really, really difficult. All the administrative stuff, all the egos, all the people, all the challenges that you have getting your athletes where they need to get to, that's one of the bigger challenges out there. So if you have a look at this has become more and more popular. A lot of different terms for it, but I'm using the term high performance director. That's a term that's become pretty popular in the college world, very, very popular in NFL and NBA. Baseball is just starting to implement this role. There's about 4 teams that I know of. that I've hired in the last 2 years a person like this. And the person's role is very different among teams. So the goal here is predominantly to focus on these areas. You got to figure out a better way of measuring and monitoring the athletes. Without that, everything we do is somewhat a guess. We need to measure and monitor better. We need to understand what we're measuring. We don't just measure because there's some technology that can help us measure. We actually need to understand what that information is going to get us. Then we also have to have faith in the information that we're measuring, meaning that there's validity and reliability to that information. Unfortunately, there's a lot of things out that have good ideas, good concepts. There's no research on the validity or reliability. And that's a lot of what we do is we analyze it. I teach a graduate class in technology and sport here. It's one of the few in the country that focuses in this area. And it's really challenging because there's some phenomenal technologies, but they're just very early stage, meaning that they don't have validation data, they don't have reliability data, they have a great concept and it probably could work and it probably could be really, really valuable in 5 years if they do their R&D. However, many companies launch early, they try it in the marketplace and their data is way off. So for example, everyone will know Fitbit. If you realize Fitbit came out with their products way years before they had any validation or reliability data. They sold billions of dollars. And then people started testing it and figured it out. It's anywhere between 50 and 30% inaccurate for most of the metrics that it's measured on the first generation. That's way too high an error rating for anything that we're going to do with athletes. So just to understand that just because it's in the marketplace doesn't mean the accuracy is there yet, doesn't mean it's had the testing and the R&D that needs to for us to trust it. Let's say with $1 million athlete, if that's the group that you're working with. So assess and analyze. Once we get the measurement and the monitoring, how do you assess and analyze? This is applicable to every person in the room. You all have an assessment technique. When someone comes in and you've got to either diagnose, many of you will be diagnosing, you'll be trying to figure out what, they have a pain symptom maybe, you got to figure out the cause. That's a form of assessment. And then the analysis is once you get a basic assessment of, hey, there's pain here, then you got to analyze potentially where it's coming from. So it's really important that that's what you do on a daily basis, but you have a systematic approach to it so that you can know when you do it well and also when you miss. We all miss. We all miss all the time. We miss a diagnosis. We miss a situation that maybe we should have done a better job of seeing. That helps us get better. Remember, the first time you ever saw an issue, you didn't know what it was. The second time you saw that same issue, you start putting it together. Hey, I've seen this before. That's how all of us learn. So we need to do a better job of understanding when we miss, why we miss, and then use that as a learning opportunity. Then we go to this training and coaching piece. This is more now when most people think performance. Okay, we've got something we're trying to perform at this point. We're trying to improve our performance. We're trying to improve the level of athlete. We're trying to do whatever we know needs to be done based on our measuring and monitoring, our assessing and analyzing. Then we train and coach. We don't even get to train and coach until we do those first two steps. Too often we try to train and coach without having a clear picture of what we're trying to do. So we need to really do a better job in all areas of going through these steps. Then the rest and recovery piece is become popular, which is great. 10 years ago, this was an area that didn't get a lot of attention, unfortunately. Now, the challenge is I think we're putting too much attention to it. Too many athletes are resting and recovering without training hard enough. So remember, resting and recovering works really well when you train hard. Resting and recovering when you don't train very hard is called being lazy. So we need to understand the difference and we need to apply it appropriately. So don't just set rest days, recovery days, if the training volume and the training intensity isn't high enough. It's really, really important to get that understanding because a lot of places have gone pretty extreme on the recovery side to the point that is detrimental. And you'll hear some data later about load monitoring and the impact of undertraining, meaning not giving enough stimulus, which can also increase injury rates. So realize that just giving extra rest can actually be detrimental to an athlete because if they have to compete in a high velocity movement, high volume type sport, and they don't have the workload to handle that, they're going to have injuries in that sport. And you're going to look back and say, hey, I gave them plenty of rest. They had 2 recovery days a week. Our volume wasn't very high. Why'd they get injured? Because we know if their adaptation or ability to adapt is not stimulated well enough, they're not resilient. They haven't developed that response to handle the game speed, the max speed that we're expecting them to be at. Really, really important concept, because too many folks, I think, are trying to do the right thing. They're trying to not overwork an athlete. The problem is it's the J curve, meaning that just like when we get sick, exercise and illness. So if anyone knows the exercise and illness relationship, when you do a little bit of exercise, your illness rates go down. It means you get less sick. If you do really high volume exercise, your illness rates go up because you're always fatigued, you're always somewhat overtrained. Same kind of concept in load and training of athletes. We need enough stimulus to make it preventative, meaning that we're giving them enough response that they're adapting. We just don't want too much to the point where they're always on that edge and about to break, or potentially they do break. So if we have a look here, we've got these areas of the model. You've got your performance optimization, the injury prevention side, body and brain, and some people break that out, some people combine that, because we all know the interaction, you can't separate it. You can train them separately, but you can't separate them, meaning that there's such a tight interaction and need to do both systems that we need to be really, really sharp about how we approach it. And then, psychological versus neurological, the breaking difference there, pretty significant in how you approach that. A lot of it has to do with the depth of the technology that you're utilizing to understand causes. And emotion plays a big part in some of that. As we know with athletes, emotion is nearly everything. We can have the most well-trained athlete do all the right things physically. If emotionally they're weak, and defining weak is hard to do, but meaning that they struggle with their emotions in the heat of battle, bad things happen. Performance is decreased, or increased injury, whether it's real or perceived, is a real problem with a lot of athletes. How many athletes do we work with that come in, and they have a tough loss, or they're struggling with form, and their shoulder's starting to hurt, or their back's starting to hurt. And the question is, you have to analyze that. Is that an injury, or is that a symptom of poor performance, and it's potentially allowing them to provide themselves with a security to say, hey, it's not me. It's not me that's making these errors. I'm not performing badly. I've got pain, or I've got a symptom that's causing me to perform badly. It's one of the hardest things you all have to deal with on a daily basis, is in competitive athletes that have egos that they're trying to protect every single day. Is it really that pain symptom and injury, or is it something that they're trying to say is causing them to limit their performance? And that's a really, really tough one, and all of you deal with it every day, and it's not easy. And there's obvious injuries. If they tear their hamstring, we know that. That's obvious. But if there's difficult to diagnose back pain or shoulder pain that isn't clear, you're making a judgment call. Even if you're going to do a bunch of scans, you're probably not going to see anything. So, and they still complain of pain, you have to make some form of judgment call as to what you best think it is. The more knowledge you have, the more times you see scenarios, the better equipped you are at making better diagnoses on that type of thing. So the technology landscape, I want to shift real briefly just to make everyone aware of what you're dealing with currently and what you're going to be dealing with in the next 5 years. And how many of you right now sort of have to deal with technology in a pretty significant way in the environments you work in? Okay, some of you say yes, a lot of you aren't sure. So again, we're not necessarily talking about Excel spreadsheets alone. We're talking about the integration of data in a way that can give us information that we have never had access to before. So we're talking about algorithms that allow us to predict future occurrences of certain things, algorithms that allow us to look at a large pool of data and then fine-tune that to something that we're interested in. From a standpoint in baseball, we're looking to see, okay, when an athlete is pitching at a certain speed with a certain pitch type above a certain number of pitches, what happens to pitch direction, what happens to pitch velocity, and potentially what happens to pain if we can monitor all that. Everything up until pain, we monitor, or good teams monitor. They monitor every piece of that data pretty easily now. The question is, we don't do a very good job of monitoring the body. We do everything outside of the body, pitch speed, pitch count, pitch velocity, direction, all the technical aspects we can nail in, and we know that really well. But very few actually are looking at how the athlete feels from the first pitch to the 90th pitch. What's happening to their body? Is there any type of symptoms that are coming up? Technology is allowing us now, depending on the type of technology, to possibly monitor that. Monitor that while they're playing. So monitor muscle activation. You can monitor heart rate. You can monitor potentially blood levels to see what's happening at cortisol and some other factors that may impact some of this. You're able to monitor forces at joints now with some wearables that are pretty exciting. So there's a lot of things that you're able to now understand a little bit better in real time during the activity, which is huge. But then we also aren't doing necessarily a great job of monitoring after, meaning that what happens that hour after they stop pitching, what's going on, what's their recovery protocol look like, which most of you probably somewhat have some understanding of. But then when they come and see you, let's say for maintenance work, it may just be post-pitch maintenance. What happens? What do they feel like? Do you do anything in your environments that you monitor that? Hey, they're sorer than normal. They're tighter than normal. Their range is more limited than normal. Are you monitoring any of that stuff in your environments? Then based on that, how quickly does that recover? The researchers love this stuff. They do that in research studies for relatively small periods of time. But as clinicians, we should be doing that as well to understand how our treatment protocols and how our environments that we're trying to put our athletes through are actually working or not working. The last thing we want to do is waste all this time on things that aren't making any impact on our athlete. It's really, really important that we make impact. So this is 1/1000th of the companies that are out there. There's thousands of companies that are popping up every single day. You go to Silicon Valley, you go to Austin, Texas, you come here in Atlanta. The Atlanta Tech Hub is the 4th biggest tech center in the country right now. And you go to New York. They're the 4 main hubs in the country for technology startups related to sports and also the health and medical fields as well. So there's a huge amount of interest. We all know that. The challenge is very few of these companies are going to exist in 5 years. They're all trying to find solutions to problems. If you have a look here, this is just one example. Training and team management, this highlighted area here. These are all companies that are trying to understand data better. Most of them don't measure anything. Most of them are data aggregators, meaning that they take in data and they try to understand it. Similar to any field, the more data you bring in, the better chance you're going to be able to solve a problem. But you've got to ask the right questions, and then you've got to understand what the outcomes mean and who they apply to. They're the 2 limiting factors. Most people aren't asking the right questions. You can't ask the question, what causes injury? Because if you ask that question, you need to define what an injury is, which is not so easy. You need to define how many days off is considered an injury for this purpose. And you need to then define the severity, meaning are they playing but they're hurt? Are they not able to play but they're not that hurt? They're just sort of recovering as a precaution. So it's very, very difficult to define what an injury is. We use some generic terms in the research literature that help us do studies, but they're very limited because there's a lot of factors that still go into many of those. So again, just be aware of what's out there. This area, artificial intelligence, I don't know if anyone deals with this yet, but it's very much here and now. It's not something futuristic. It's happening today, and it's where everything's going. Because as much as we're pretty smart, some of us, what we try to do is analyze data with what we know. And we're pretty limited in what we know. Artificial intelligence is analyzing data and changing what they know based on the information that they're given. So it allows you to move at a much faster rate, analyze millions of data points in the same time it would take us to analyze 5 data points. So the challenge is there's still people that have to create the software to make sure that this works correctly. The problem with any time we use technology that no one understands is we don't know if it's right or wrong with the numbers that we're getting on the back end. And that's the biggest problem right now, is it can spew out some numbers. We're not sure if those numbers are accurate. We're not sure if those numbers make sense. And we have no real knowledge, most of us, to understand how they even got to those numbers. You know, it's a black box scenario where you have proprietary information that numbers come in and then numbers get thrown out. We don't know what those numbers on the back end mean always, so we have to be somewhat circumspect with how we're applying some of this. But you do have to be aware of it. So this landscape is really, really large. And you have a look here, you have fan engagement, you have all the business side of things, how do we get more people, you know, watching sport, you know, interacting, things like that. But our world is sort of in this athletic performance world here, where again, there's thousands more companies, but the challenge is how do these companies give us information that can help us do our clinical work? It's all we care about. That's our number one goal, is how do we get information that helps our athletes do one of those two things we talked about earlier: improve performance, reduce injuries. So all of us need to ask the right questions first off. So how many of you understand that daily loading cycle? Every athlete goes through this on a regular basis. There's some form of stimulus, there's some form of training. The athlete either adapts positively or adapts negatively to that. Based on that, there's a recovery timeline that they go through, and we're a big part of that usually. We're trying to speed that recovery cycle. Our job is to get them to be fully functioning at or above, preferably above, the level they were at before the previous training session. That's all it is. So if we go in with that mindset, then your decision making becomes a lot easier because you know where you fit. If you're just, say, coming in and treating a shoulder or a knee or a hip or a lower back complaint, you're very isolated in how you're approaching it, and you're missing all of this. You're missing causes, you're missing the issues that end up with the symptom. Symptom treatment is necessary sometimes if they're in significant pain, but we got to go to the cause. We always have to go to the cause if we want to do a really good job. So we have to be careful when we talk about all this stuff because everyone wants to be cutting edge. The problem is we sometimes forget tried and true is really good for a reason. It works. Tried and true that works is way more valuable than being cutting edge, because cutting edge is risky. You don't know if it works. You don't know short-term results of it. You definitely don't know long-term results of it. For example, last year we talked a lot about weighted balls. In one of the presentations I gave you the research on weighted balls. And that was one of those examples at the time we talked that there's a significant medium to longer term risk. The data hadn't fully come out yet. We've seen a couple more studies recently that have come out to sort of support that, but it made logical sense because what you were doing, you were increasing external rotation pretty significantly in the short term, which typically leads to an increase in ball velocity more often than not. So short term, people felt great. That 85 mile an hour picture is now an 88 mile an hour picture, and everyone's super happy. That 92 mile an hour picture is 94. You know, that 98 mile an hour picture is 100. So everyone's feeling good about themselves because the results are positive. The problem was it was relatively new, and the longer term outcomes weren't very well known. We're seeing more and more data showing that, hey, we're starting to see some pretty significant issues with that type of training over the medium to longer term, which, you know, biomechanically makes some sense. We just didn't have, and we still don't really have enough large data sets to, you know, confirm it entirely. But again, part of our job is using the best available science to make judgment calls using that information. Because as we talked about earlier, every athlete's a little bit different, and we got to make sure we're smart about how we approach it. So when we're talking about monitoring, and all of you monitor some way. Many of you may monitor with your hands, and that's your stimulus. You put your hands on someone, they respond, that gives you a trigger, you make your decision based on that. There's also a lot of other factors, and these are a short list. We have internal objective, meaning we're monitoring something from the athlete that's objective. So you can see here things like heart rate variability, you know, VO2, lactate levels, things that are internal that an athlete can't fake. It's impossible really to fake these, so it's not subjective. It's an objective internal measure. We have internal subjective. So that's trying to get at things inside the athlete, but we're asking them questions usually. So there's still a major subjective component to that. They can lie, they can convince themselves that they're telling the truth, yet they're still lying, which happens a lot with athletes. Athletes are really good at putting up barriers as a protective mechanism. Many of the best in the world do it the best. They convince themselves of something even though it's not true. That's one of the reasons why they're great. The challenge with that is it makes subjective data sometimes misleading. Okay? Then we have external subjective. So that's typically us. We assess, hey, we think you're feeling this. We think you're doing this. We're using a subjective external metric to figure out the athlete. So really important, because sometimes we do know the athlete better than they know themselves. We have to be careful, though, to think that we know more than the athlete all the time. If we go into the room thinking we're the smartest person in the room, usually you're not. Most of the time, there's someone else in the room, and that person's usually smarter than you, and you have to listen before you speak. Sometimes we're too quick to speak without understanding, because the athlete's usually going to tell you a lot of things symptomatically that you feel, and verbally and body language wise, that's going to give you a real good picture of what's going on. And then our external objective. This is where I would say most of the technology is focused right now. Probably 80% is focused here, the technology. 15% is focused on internal objective, and then less than 5% on the right side. That external objective is all that stuff that we're trying to monitor. Monitor accelerations, monitor forces, monitor loads, monitor fatigue, monitor all these things that happen to an athlete through the course of training, through the course of recovery, through the course of sleep. And that's going to be the challenge. The challenge from that perspective is to understand, one, is it measuring accurately? Because it's really hard for most of you to know. You trust a screen, an app, a phone. It shoots out a number. The number looks interesting. How do you know if it's actually real? That's when you've got to trust the research, published research, that is giving you some confidence that it works. And then what does work mean? Nothing's 100% in the technology world. Because they're comparing it usually to a gold standard, and the gold standard has error. So if you're looking at force production, for example, and we do a force production comparison to an isokinetic machine. Most of you are familiar with isokinetic machines. One of the more traditional gold standard type measurement devices out there, lab grade equipment, but that still has error. There's still a couple % error in isokinetic measurements. Then when we use some form of wearable technology that is compared to that, and that has a 5% error, that 5% error is actually more than that because you're comparing it to a gold standard that already has error. So we have to realize that error is part of what we do. We can't get anything that is perfectly, matched. We just got to understand what's acceptable error. In your life, what's acceptable error? In your clinic, what's acceptable error? What are you willing to go with to get a piece of information that you typically don't have, even if it's off? Usually for most athletes in a real-world setting that isn't a pure research study environment, anything less than 10% is pretty good. I'm personally very happy. If I've got wearable technologies that are less than 10% error, that's giving me something that I didn't have before, and I understand that I may be off 5 or 10%. But that's still giving me 90%, say, of information that I may not have been able to get access to, and I just got to understand that there is potentially some error there. So just to let everyone know, patch technologies, where things are headed. So watches, as much as people want to measure a bunch at a watch, that's not current technology. It is for the consumer, but it's not for the athlete. Watch technology doesn't give us much good information. Measuring heart rate at the watch is highly inaccurate. So that's the problem. Measuring sweat at the watch is something that people are working on, and they haven't fully figured it out to do it right yet. But patch technology or nanotechnology patches is where everything's going. And then ingestibles is another big area where you actually ingest and can monitor throughout the day. And a lot of things are being trialed in an ingestible form. And then you've also got, injected, meaning that chip technology, similar to what some animals have to make sure that they're not lost. Like they have GPS trackers that get injected in. Humans are getting that as well. So we got to understand this is all current. It's not futuristic. It exists. The technologies and how we monitor through those devices are being worked on, and we need to, really trust a little bit before we get there, because that's the challenge. We can measure a lot of this stuff currently. We may not be able to measure it accurately enough for what we need, and we may not be able to actually get at the data that we need today. However, the mechanisms to get there exist, and there's a lot of sharp people working on that all over the world. So let me just, again, briefly, just so we're aware, we have GPS, which I think most people are aware of. That's load monitoring. You have heart rate variability, which many of you hopefully are aware of. So heart rate variability is a combination of a couple things. It's not heart rate. A lot of people initially, when they hear this, they think, okay, I've been monitoring heart rate for 25 years. Heart rate variability is looking at the R-to-R interval of each heartbeat. So that's the time it takes between each R interval in the QRS system of the heartbeat. And the challenge with that is it's irregular. It's not the same. And based on the timing of it, meaning that every R-to-R interval has a slightly different time frame, in milliseconds usually. So one could be 0.7 of a millisecond, one could be 0.5, one could be 1.0. That variation is called the variability. And that allows us to get a window into what's happening with an athlete. The challenge is people are using that as a be-all, end-all number to tell them about athlete readiness. Okay, sort of how tired are they, or how engaged are they, or how ready are they to perform. And the challenge with that is it's not as simple as that. There's a lot of noise in R-to-R intervals. There's a lot of equations that go on the back end to make that happen. But it does give you a window into understanding where an athlete is. So that's something that is being utilized a lot. How many of you are familiar with heart rate variability? Few people. So, does anyone use it regularly right now with athletes? Okay, no one's really raising their hand. But many of you that you work with may be utilizing it. So you may start hearing about the numbers, what it means. You want to make sure you're at least in the mix and you can have a conversation about the topic. So for example, this is some heart rate data and we get some heart rate variability info. And again, it can look complicated. It's a bunch of numbers, bunch of lines. But really what we're looking at changes in our variability, and we're looking to see when during different activities we get that information. So that allows us to then make decisions about when to increase or decrease volume, when to push an athlete harder because we feel like they're ready, or when to pull back. And unfortunately or fortunately, some people will use this one number to make all the decisions. Same with GPS. GPS numbers are one number. It's accelerations basically, and total volume. That's what it gives us. That by itself doesn't give us the full picture. We don't know muscle fatigue. We don't know factors related to other things that are going on. Same with heart rate variability. But you start putting heart rate variability with GPS, with performance metrics, with a coach's eye or a trainer's eye, then you start getting a better picture of where the athlete is and when to pull back or when to increase. So loading overreaching. From this standpoint, I just wanted to go back to this slide because we got to keep this in mind as we go forward. We've got to make sure that when your athletes are going through these cycles, which they go through every single day, that we're on top of it. We understand when it's happening and that we make our adjustments when we see them. Fully understanding that many of you may only see them once a week or twice a week. You may not be in their life that much that you see them throughout every day. But you still want to know when they come to see you, where are they in their cycle and how are you going to help them improve it? Let's say, if we're in this period here where they're overloading and they come see you because they're real sore, real tired, nothing's majorly wrong, they're just coming for prevention type work or maintenance work, you got to understand that, hey, we know you're going to keep busting it for another day or 2 or 3 days. How do we improve your time so that you optimize that? Or if you get them here, where they're in the major recovery period. It could be within a day, like your daily recovery, or it could also be in a cycle where, let's say they're doing 3 days straight, where they're going, or 3 weeks straight, sorry, where they're going super hard, and then they've had a download week, and now this is the beginning of the following week after download, and they're on their way up. So they're on their way up, which means how do we deal with them differently? Would all of you treat them the same way if you saw them here or if you saw them here? I hope not. I hope we're not treating them exactly the same based on, generically, this is what I do with the athlete. We want to adjust to where they are in their, load and recovery cycles, because they need different things. They need different stimulus. They need you as the experts to help them get through those different cycles with different techniques. Velocity-based training. So understanding how velocity-based training is being implemented. So all this is changing the concept of how heavy do you lift a weight to how quickly do you lift a weight. That's it. We're just changing the paradigm. It used to be everything was one RM, 1 rep maxes. Okay, you could squat 400 pounds, you're a good baseball athlete, from a standpoint of lifting weight. Okay, or you could squat 2 times body weight for your 1 rep max. That's considered pretty strong. So that's been the uniform way of monitoring strength for 100 years, more than that probably. But since books have been written on strength training in an athletic environment, it's less than 100 years old. So over the last probably decade and a half, bar speed has become more and more popular. It used to just be in Olympic weightlifting. You'd have to attach a unit to the bar to monitor bar speed. Now there are wearables that can monitor this in every movement. It doesn't have to be barbell movement. It can be body weight movements. It can be all sorts of things. So you're using accelerometers and 3D gyroscopes to help give you information in real time about the athlete and what they're doing. The beauty about this is you can see a decrease or an increase, but typically a decrease in velocity over multiple reps. So whatever it is, it could be pitching, it could be lifting weights, you may start seeing a velocity shift, meaning that if your bar speed was, let's use round numbers, 2.0 meters per second, that's how it's measured in meters per second. If the bar speed or the movement of the athlete was 2 meters per second on the first rep, by the 8th rep it was 1.5 meters per second. Same weight. What does that tell us? Athletes slow down. There's some form of fatigue that's occurred there. Based on that, you got to make a call. Do you stop the reps? Hey, you're slowing down too much, fatigue has set in too much, and we increase our risk, which is true. Or you say, that's exactly what I want. I want you to fatigue a little bit, and I want to push you through a little bit of fatigue so you adapt better. You've got to have a set point, though, similar to if you're looking at, stock traders do this all the time. They have a stop metric. So when it gets below a certain point, they sell. When it gets above a certain point, they sell. They have metrics in place. We have the same concept here. When an athlete gets their velocity above a certain point, that may be risky, potentially. Anytime an athlete is going at max velocity, risk increases. We know that. Anytime an athlete is going very low on velocity over time, we know they're fatiguing. So both of these give us an immediate window. Many of you can watch someone do an activity and say, hey, yeah, they're fatiguing. When someone's doing 10 rep squat, the last 3 reps on a squat, most of the time if they're going close to their max for 10 reps, is not going to look as perfect as the first 2 or 3. They're going to fatigue a little bit. However, we don't necessarily know what's acceptable. We eyeball it. Hey, your technique's breaking down, and a lot of the time you just scream at them and say, push harder, push harder, push harder, which may not be the right strategy. If we actually use velocity as a metric, we can see how much we're decreasing, and that can really help. So yeah, it's something really, really useful, quite low on the cost factor as well. So, it's not a super high-priced item, so it's starting to be utilized more and more, and you're going to start seeing it used more and more.